In the new episode of COVID Chronicles, we will tell you why they closed schools in Kazakhstan. 165 schools have been closed. Who is behind the project MedSupport KZ, which helps doctors find relevant information about coronavirus in times of infodemic? There is too much fake news and absurd information. How is the pandemic going in the US, and how is the country helping Kazakhstan?
It's true that the situation in the US right now is not good.
Let us share the advice of psychologist Zarina Steer, who will tell you how to overcome the fear of pandemic.
About 70 schools are closed for quarantine in Kazakhstan due to infection of students and teachers. This was reported by the chairperson of Sanitary and Epidemiological Control Committee, Ayzhan Yesmagambetova. The Ministry of Health has defined quarantine terms in educational institutions in case of detection of infection. According to the ministry, since the beginning of the school year, 1,741 cases of coronavirus infection have been registered among students, including 482 among children studying in duty classes. In total, 165 schools have been closed since September the 1st. The minimum period for which a school is closed for quarantine is 14 days. This is the minimum incubation period. This is in case if the whole school was closed and everyone went to quarantine. If several cases are identified in one class, the incubation period is considered from the last case. I tried to help doctors by cooking food for them, providing material support, but I realized that I can help one hospital, too. But this help needs to be scaled up to the whole of Kazakhstan so that any doctor from anywhere in the country could just read the information. I thought I needed to do something. I met with a scientist from Nazarbayev University. I presented my idea to her, and although we did not know each other, she supported my idea. We announced that we were looking for volunteers, scientists, or practicing doctors. Every doctor feels that she needs to help people, so when I saw the announcement that Akmaral and Dana are looking for people with a scientific education, with knowledge of English, especially doctors for informational support, I realized that this is my chance to help people. Now we have 90 volunteers, most of them are young researchers from Nazarbayev University. 15 scientists do not live in Kazakhstan. They are citizens of Kazakhstan, but they are studying in Switzerland, Germany, USA. The idea of our project was to provide informational support for doctors in Kazakhstan because doctors, like all people, are very vulnerable to infodemic. And since the virus is new and we didn't know anything about the virus 6 months ago, the doctors needed reliable, relevant scientific information, research protocols of different countries, and so on, so that they could feel confident in the hospital when they help people. People want treatment here and now, and unfortunately, the research was translated very late. We are looking for information in leading medical journals. We have very strict criteria for scientific research. We choose only the most practical, the most useful for doctors. We started simply by translating articles, but then we realized that not only doctors experience problems with access to knowledge, but also all people. That is why on our Instagram we started to talk about medicine in simple language. We understood that people need it. It finds a response among people. 2020 has become the year of infodemic, when there is too much fake news, absurd information. It is very difficult for an unprepared person to understand what, where, and when. At the beginning of the pandemic, all kinds of fake treatment protocols were distributed. At first, 3 types of antibiotics were prescribed, although antibiotics had nothing to do with viruses, but with bacteria, and did not affect the treatment of COVID-19. Then anticoagulants started to be prescribed, and we realized that we can help thousands of doctors. We can acquaint them with the best world practices. We can acquaint them with the opinion of other advanced countries. I was mainly engaged in the translation of clinical protocols. Our work is divided into different parts. There is more scientific information that interests more biologists, scientists, as well as doctors who are engaged in clinical research. I have been translating practical information, and as a doctor I appreciate that there is information that can be immediately applied in practice. These are protocols that America and Europe are using. The most absurd fake is that there is no virus. It is some psychological problem of people who cannot accept reality and are making up such things. I do not know which people think like that, but it is absurd. At the very beginning of the pandemic, Chinese scientists shared with the society the source of the virus, and every scientist could inspect what kind of virus it was, what genes were there. The second and the most harmful fake is that masks do not help and that masks accumulate greenhouse gas or something else, and it provokes asthma, it provokes hypoxia, and so on. However, surgeons who perform the operation wear masks for 12 hours, 18 hours, and they don't experience any harm to life and health. I often receive fake news, protocols, information about food supplements, something like that. I am very upset. I have learned not to be angry about it, although it burns from the inside, because I have seen patients who died or were very hurt because of wrong treatment protocols. Just trust doctors of evidence-based medicine who prescribe treatment based on their experience, as well as that of colleagues around the world. For some reason, doctors are not interested in my page. Just ordinary people are interested. During the highest incidence of the disease, one video appeared where a doctor from Shymkent, her name is Ayna, was talking emotionally about how to do that. She recommended to take the relatives, elderly parents from the intensive care unit to do breathing exercises, although it is contraindicated for people in the intensive care unit. She began to prescribe corticosteroids, anticoagulants without seeing patients, without knowing the whole situation. She started prescribing a lot of powerful drugs which have a lot of side effects. And the reaction did not keep waiting for. Unfortunately, some people accepted her recommendations without criticism. In our hospitals, we began to receive a lot of patients with internal bleeding. People who could have experienced the disease in a mild or moderate form began to have complications such as hypertension, high sugar, or low blood pressure due to dexamethasone or other drugs. Most people have not seen events of this scale, so it is scary. It's just scary. Therefore, when people are scared, this reaction occurs. There is no information, nobody knows anything, nobody recommends anything, so we just take any information that is around. We accept the information about 5G and chemtrails or Bill Gates because it calms us down. It's a lie, but it gives people comfort. People are anxious, people are scared. Now, our project educates people in terms of health, how to prevent COVID-19, how to wear masks correctly, which diseases put you in a risk group, and what to do if you, for example, have diabetes or problems with blood pressure. We help pregnant or lactating women. They are very vulnerable because they are worried not only about themselves but also about their children. To help the people of Kazakhstan come out from the pandemic with the least losses, we provide them with reliable scientific information so that they have a choice of what to believe in. We offer them a scientific approach. In the United States, the number of COVID-19 infections has exceeded 13 million. By these figures, the country is in first place worldwide. Daniel Singer, Regional Director of the U.S. Central Asian Office of the Centers for Disease Control and Prevention, will tell us about the situation on the other side of the planet with coronavirus and how Kazakhstan is cooperating with the U.S. in the fight against the infection.
It's true that the situation in the U.S. right now is not good. We have had, for the last several weeks, record numbers of cases, and we're also seeing more disease in more remote and rural parts of the country than we had in the past. We're watching closely because there was a big American holiday just a few days ago, and many people traveled. So we're looking over the next few weeks to see if there will be additional spread of the disease caused by people visiting family and friends over our Thanksgiving holiday. Unfortunately, we've had over 250,000 people who have died from the disease. So it's as I said, been a difficult period, particularly in the last few weeks. And there's several factors that are related to that. One has to do with the fact that we are a country of states, and each state has its own legal authority to respond to the disease how it sees fit. So we don't have a national set of response policies, but we have national recommendations that have to be implemented at the state level. In America, as I said, those types of restrictions are decided at the state level, which would be similar to a ACIMAT level here. Those rules are at the decision of those states, and therefore we can have 50 different sets of rules. The recommendations of the CDC is that people do what they can to reduce their interaction, that they avoid travel, particularly during this holiday period, that they always wear masks when they're out of their house and interacting with others, that they frequently wash their hands, and that they monitor themselves for any sign of infection. So the basic recommendations are the same in the US as they are for the rest of the world.
Daniel, please tell us about the cooperation between Kazakhstan and CDC on fighting COVID-19.
Well, we've been involved in working with the Kazakhstani Ministry of Health since the beginning of the pandemic. And we've actually been working with the Ministry of Health for a long time. This is our 25th year of having an office in Kazakhstan and collaborating with the Ministry of Health. So we started the pandemic already with a good basis in a long-standing relationship. For COVID-19, we have pledged about $1.7 million to support the government specifically for COVID-19 response. About half of that, a little more than half of that, is for laboratory equipment and laboratory supplies that the government needs to be able to diagnose COVID-19. But we're also working with the government on training. We've delivered online trainings to almost 700 health workers in the country so far. We are supporting the training of epidemiologists and public health experts through our field epidemiology training program that's been in existence since 2003. And we're actually expanding that program this year with Asfindarov Kazakh National Medical University. We'll now be offering that training as a 2-year program that includes a master's degree as part of the training. We're also working to support the Emergency Operations Center, which is in Nur-Sultan, that we helped develop over the last several years. And we're working on improving the ability to screen for disease at the borders and the ports of entry.
Okay, that's good. Thank you very much.
All right, thank you.
Действительно, у нас люди, которые переболели в более легкой форме, для них последствия, реабилитация после ковида.
For people who have experienced the disease in a mild form, the consequences, rehabilitation after COVID is easier in all aspects. It is also easier in psychological, psycho-emotional terms. People who have suffered from a severe form of COVID are going through a difficult time now. It seems that there is no threat to physical health anymore, but people's anxiety persists and sometimes grows. People who have been infected become more anxious when they receive all this fake news from a variety of sources, where they say that the virus mutates, the virus will be more complicated, there is no immunity and children may be at risk. Consequently, this aggravates this process of rehabilitation in people with illnesses because the psychic liability is very high. People who have experienced COVID suffer from it. This anxiety paralyzes, it destroys and exhausts the psyche that has already been affected. Therefore, people who have this high level of anxiety, we can recommend only one thing: to seek help from psychologists and psychotherapists, because this state of anxiety destroys the psycho-emotional state of a person much more than any external factors.
It's time we learn to live under the current epidemiological situation. It will not change in one day, and living with this fear every day of your life, building the anxiety, thus creating a common anxious background, is out of senses. It is very destructive to the psyche.
Это не объективно и очень разрушительно для психики.